Today, we are diving deep into one of the most important parts of your OSCE, the implementation station. Yeah, specifically focusing on the medications you are to administer during your exam and those ones you are to omit if you are not given. This could be the difference between a pass or a fail. So don't just watch this video once. Revise, revisit, and reinforce your knowledge. First section is control drugs. Do not be tempted to administer controlled drugs in your exam if at all it appears on the chart, because you are not yet qualified to do so. Doing so out of excitement or out of sight and out of mind may be critical. It may come as a trap, who knows, that it is even due at your time. Don't be tempted to give. Rather, you verbalize you will not be giving this drug because you are not licensed to give, that you'll be escalating, and a senior colleague may probably come to administer the medication. I repeat, do not be tempted to give. It could be a critical fail. Medications in this category must be checked and signed by 2 nurses. So if it's coming for you in your exam, please do yourself a favor by coding the medication. Code the medication and sign against it. Also turn to the last page of the mark chart and fill in the details appropriately. Medications in this category include and not limited to oral morphine, shortened to oral morph, morphine sulfate, methadone, codeine phosphate, or oxycodone. So, having discussed on the medications you are not to give during your OSCE, let's move on to those medications you are to administer, their indications, and the side effects. First, oxybutynin. The indication is for overactive bladder. If you have any patient that is to take oxybutynin, do encourage the patient to ensure he or she takes at least 2.5 liters of fluid per day to ensure hydration. The next medication is calcium carbonate. Indication is a supplement for bone and teeth. The side effects include and not limited to hypercalcemia, nausea, or vomiting. The next category of medication is proton pump inhibitors, that's PPIs. Some of the medications under this category include and not limited to lansoprazole or omeprazole. The indication is for gastric ulcer or acid reflux, which is also known as GERD, G-E-R-D. Some of the side effects you may or may likely not to encounter include and not limited to nausea, vomiting, or abdominal discomfort. The next category is anti-hypertensive medications. Example of medications under this group include and not limited to ramipril, losartan, or amlodipine. The indication is for high blood pressure or stroke prevention. Some of the side effects you may or may likely not to encounter include and not limited to dizziness, headache, or hypotension. The top tip for you regarding antihypertensive medications is you need to check with your assessor the blood pressure of the patient before you administer this medication. Do not administer, you code instead if the blood pressure of this patient is less than 120/80 millimeter of mercury. The next class of medication we are going to be looking at is anti-diabetics, that is oral hypoglycemics. Example of medication under this class include and not limited to metformin or gliclazide. The indication is to control glucose level. The side effects include and not limited to GI disturbance or hypoglycemia. The top tip for this station, just like in the case of antihypertensive, check with your assessor the current blood glucose level of the patient. Right, do not give and code instead if the blood glucose level is less than 4 millimole per dl. The next group is analgesics, that is painkillers. Medication under this group include and not limited to paracetamol or aspirin. The indication is for mild to moderate pain as well as inflammation. Some of the side effects include and not limited to, for aspirin, there can be bleeding risk, so you need to avoid it in case of fall or head injury. And for paracetamol, some of the side effects that is common to paracetamol overdose include liver strain, nausea or vomiting. The next category is antiarrhythmics and beta blockers. The medication under this group includes and not limited to bisoprolol or digoxin. The indication is irregular heartbeats or hypertension. Some of the side effects include and not limited to bradycardia or dizziness. Top tip for this station is check with your assessor the blood pressure and the heart rate of the patient. Do not give and code instead if the heart rate of this patient is less than 60 beats per minute and the blood pressure less than 120/80 millimeter of mercury. The next group is antibiotics. Example of medication under this group includes and not limited to nitrofurantoin, co-amoxiclav, amoxicillin or clarithromycin. The indication is for infection. Some of the side effects include and not limited to GI upset or allergic reaction. The top tip for you is, in most cases, more often than not, medications such as amoxicillin or co-amoxiclav is usually prescribed knowing fully well that this patient is having allergy. It is now left for you to critically think and decipher to know whether or not to administer the medication. It will be critical for you to say you will not be administering clarithromycin because patient is allergic to penicillin. Clarithromycin is not a penicillin derivative. Yeah, so you can safely administer clarithromycin even to patients that is having allergy to penicillin. But do not administer co-amoxiclav, amoxicillin, or flucloxacillin, right? Moving on, the next group is diuretics. Example of medications under this group include and not limited to furosemide, spironolactone, or bendroflumetazide. The indication is to reduce fluid overload as well as to manage heart failure. Some of the side effects include and not limited to low blood pressure or electrolyte loss. So the top tip for you in this station is you need to continually monitor the patient's blood pressure and to ensure the hydration level is optimal. The next group is anti-sickness, that is antiemetics. Some of the examples under this group include and not limited to cyclizine or ondansetron. The indication is to manage nausea and vomiting. Some of the side effects the patient may or may likely not to manifest include and not limited to drowsiness, dizziness, or headache. Moving on, the next group is supplements. Example of medication under this group include and not limited to ferrous fumarate, ferrous sulfate, or thiamine. The indication for this medication is to treat anemia or deficiency. Some of the side effects the patient may or may not manifest include and not limited to constipation or dark stool. Moving on to the next medication, which is leothyroline. The indication is for underactive thyroid, that is hypothyroidism. Some of the side effects the patient is likely to or not to manifest include and not limited to palpitation, anxiety, or GI upset. It is worth mentioning that this medication must be administered 30 to 60 minutes prior breakfast. Lastly, on the group of medications is steroids. Example of the medications under this group include and not limited to prednisolone. The indication is for inflammation or autoimmune condition. Some of the side effects the patient may encounter include and not limited to weight gain or increased blood sugar. So it's worth mentioning that any patient that will be on steroids, the blood glucose level needs to be kept in check. Here are the top tips for this station. Only administer the medications that are due at your time. However, it's worth mentioning that you must read all the charts, whether or not you are given the medications, or whether it is due at your time or it has been previously administered. However, you won't need to talk about the indication and side effects if you are not going to administer. Right. The second top tip is always confirm the patient's allergic status. Very important. Next, check patient's vitals where necessary, such as when you are giving Ramipril, you check blood pressure. If you are giving bisoprolol, heart rate is essential for you to check. You are giving furosemide, you need to check the blood pressure of this patient. And if below 120/60 millimeter of mercury, do not give, but code instead. And if the heart rate is below 60 beats per minute, code as well. Also, you check patient glucose level before you administer anti-diabetics. In any occasion that you need to omit any medication for any reason, append your signature by the side of the code and turn to the last page of your MAR chart to appropriately document every detail that has to do with that medication you are omitting, stating the reason for omission. Right. And there you have it. A full breakdown of the medications you need to know for your OSCE implementation stations. Remember, knowledge is your best preparation. Understand what to give, what to avoid, and always stay safe. Watch this video again or practice with your pillow or use self-record so that you rewatch and assess yourself if you are doing well. I will see you in my subsequent videos, and until then, keep practicing OSCE. Bye!